All right, ABGH CCAW, take one. Hi, my name is Dr. Sophie Balzora. I am a gastroenterologist and I specialize in the care of inflammatory bowel disease. I am at NYU Grossman School of Medicine, a clinical professor there, and I'm also president and co-founder of the Association of Black Gastroenterologists and Hepatologists, or ABGH.
And I'm Ugo Iroku, MD, gastroenterologist in New York City, general GI, but with a focus on inflammatory bowel disease. I am an assistant clinical professor at the Icahn School of Medicine at Mount Sinai, and also one of the co-founders of ABGH, the Association of Black Gastroenterologists and Hepatologists.
All right, how do you think AI is going to do?
What do you think, Dr. Ugo?
Well, I think that AI is going to probably have some data, but I wonder how well we'll be able to tie it all together.
Okay. I don't know. I think that there's going to be a lot of things that we disagree with, to be honest. There's Dr. Google out there, there's AI, people always looking up symptoms, and we kind of have to debunk a lot of myths these days. So I actually don't have that much faith in AI. I'm really curious to see what happens.
All right, let's see.
Should I be on a probiotic every time I take an antibiotic?
Not everyone needs a probiotic with antibiotics, but some people benefit from it depending on the situation.
Okay, interesting. So probiotics, really hot right now, right? Everybody wants to be on one. Everybody always asks about them. I don't know what your experience is, Dr. Ugo, but that's how I feel. I think the AI answer is pretty on point. I think that there's never any absolutes. I will say for probiotics, the evidence is not so great. So I definitely don't recommend blanketly, like everybody who's taking an antibiotic, absolutely take a probiotic. And so that's usually how I guide people. It's definitely nothing that's an always.
Yeah, I think I agree with that. I think in terms of, for those of you out there who love your probiotics, there have been some studies that suggest probiotics can show a positive improvement, a reduced risk of antibiotic-related diarrhea. Mm-hmm. But as a whole, our national guidelines that come from organizations like the American Gastroenterological Association do not endorse universal use of probiotics. So I'm going to have to give this one to AI. I think it did well. We agree.
Is it normal if I don't poop every day?
Yes. It's normal for some people to skip a day. What matters most is that your bowel movements are comfortable and consistent for you.
Wow. AI does it again.
Yeah. It's pretty good.
So I'm going to say that absolutely you do not have to go to the bathroom every day, right? What's considered normal is a very wide range. So usually we say normal is anytime from 3 times a day to 3 times a week. But not only how frequently you're going, but is that what you've always been doing, right? So sometimes people can be a 3-a-dayer and then all of a sudden they're a 3-a-weeker or vice versa. And that's where, it may be good to seek medical attention just to be sure that, that is still within the realm of normal. But the other thing is not only how often are you going, but what does it look like? So I do have something handy here. Dr. Ugo, have you seen this before?
That is our Bristol stool chart.
Yes. So always good to have a nice guide, right? And so we like to aim for type 4, which is resembling a thin sausage or snake. So also when we reference food or animals, I think that can be helpful in knowing what's what.
That's right.
So you see anything above a 4, 1, 2, and 3, that's usually what we constitute as constipation. You see like hard pebbles or cracks in the stool. And then 5, 6, and 7 is more diarrhea-like, right? Watery stool, very loose stool, it's not formed. So this is really the sweet spot. You're aiming for a sausage or a snake 3 times a week to 3 times a day.
Yeah, I completely agree. I do think that for some of my patients, once they start hitting again the type 2s and type 1s, or even heading in that direction, and even if they're only moving their bowels 3 times a week, I do start to warn them, hey, just be on the safe side. Maybe make sure you're getting some fiber, get a lot of fluids so that things don't get any worse. But technically, AI is right. 3 times a week's allowed.
Yep, I like it.
I had a ghost poop. Should I be concerned?
A ghost poop is when you feel the urge to poop but nothing comes out, or when you poop but it leaves no residue or visible stool in the toilet.
All right. Well, I think I'm going to agree with AI on that one. Yes, as described, a ghost poop, some people describe as a perfectly laid, let's just say poop, that is comes out on one fell swoop.
Mm,
It's not a floater,
okay.
goes straight down and leaves little residue on the bottom or on the wipe. The reason why I agree with it that it's probably a good thing is that it suggests at least there isn't a high fat, undigested fat content in the stool. So that's important. Some people are having poor digestion that would lead to floaters. It's also suggesting it's not smeared, which some people can report when they have infectious colitis or other infections that might be affecting their digestion. And so, as a whole, high fiber, dense, floating poop, I'm going to say is a good thing.
Okay. Yeah, I mean, it's a weird terminology, I'll say, definitely a
I
newer one.
agree.
But I just want to put out a disclaimer that if there is a little bit of smear, if it doesn't disappear, if anything like that is happening,
Welcome
you
to the
also,
club.
yeah, exactly. Like everybody poops. Let's talk about it.
That's right.
But that shouldn't be a cause for alarm either.
We agree.
Yeah.
Can I have IBS if I already have IBD?
Yes, people with IBD can still experience IBS-type flares.
Yeah. So I agree. I think it's important first, of course, to do some definitions
Yes.
quickly.
Right.
IBS is irritable bowel syndrome, and IBD is inflammatory bowel disease, and they're very different. For irritable bowel syndrome, there's no ulceration, there's no inflammation in the gut, but still the patient can have quite a lot of discomfort, can have multiple bowel movements. Sometimes it's in the opposite direction, and they can have constipation. Whereas inflammatory bowel disease clearly is marked with symptoms like abdominal pain, increased bowel movements, sometimes bloody stools, depending on exactly where the inflammation is in the gut. And so, what's the deal with IBS
Yeah.
versus IBD? The answer is that sometimes there's an overlap, and there are unfortunately some people who are unlucky enough to have both. And believe it or not, it's actually very common. About a quarter to 20% of patients with IBD can have IBS symptoms. And so, like we've mentioned before, not all the time when a patient has IBD symptoms is it truly coming from inflammation? And sometimes it's actually coming from IBS. Their abdominal discomfort is really coming from their irritable bowel syndrome, and we treat it with IBS medications.
Yeah, I would agree. And sometimes it's tough to tease out. And so that's why we have blood work. That's why we have stool tests. That's why we have exams like colonoscopies and upper endoscopies to try to differentiate between the two. Because it really is important. You don't want to give somebody, steroids, for instance, for their IBS symptoms. That's not really appropriate. So that's why we really need all of that information when people come in with symptoms, because we want to differentiate between irritable bowel syndrome or IBS and inflammatory bowel disease or IBD, like Dr. Ugo has said.
Yep. So ultimately, you and your doctor will get to know your symptoms of IBD a little bit more over time and how those might differ from your IBS flares that might occur from time to time.
Should I stop my IBD medications if I plan on having a baby?
You should never stop IBD medications when planning a pregnancy without talking to your doctor, as many are safe to continue.
Okay. I'm going to have to give a check to AI here. I think it's always important to talk to your doctor before making any big move, any decision on medication changes, stopping medications, starting medications. If you have a condition like inflammatory bowel disease or IBD, a lot of times when people are diagnosed is when they're thinking about growing their family. But thankfully, we have a lot of therapies available to us for pregnant people or people who are looking to get pregnant that are safe and effective in pregnancy. And there's been a lot of literature that supports this. So I think that that's really helpful, really reassuring to families who want to have children. There are a couple of medications that are not safe to continue in pregnancy, but before making that move, it's just critical to talk to the doctor who's prescribing the medication, who's taking care of your inflammatory bowel disease. I think overall the news is quite good, and then a lot of medications can be continued safely, but it's always good to consult your doctor first.
Yeah, this has always been a major concern because ulcerative colitis and Crohn's are diseases that do affect young people in their teens, 20s, 30s, just when this question is rising up. And there used to be medications that we used to stop months before delivery, decades ago, but the practice showed that the healthiest thing for baby ended up being healthy mom. and stopping the medications and risking having a mom who has a flare of disease turned out not to be the best thing for the baby, the
Yeah.
patient baby.
Yeah.
And so, yes, we agree for the most part. In most cases, continue the medications. In the few instances where that's not the case and there needs to be a switch, talk to your doctor, and your doctor will guide you through that discussion.
Absolutely.
Does ulcerative colitis only affect the colon?
Yes. Ulcerative colitis affects only the colon.
See, I've been waiting for this. AI, you're wrong.
Ooh.
So,
Ooh. Oh, okay.
so unlike it might be commonly believed, inflammatory bowel disease is not a disease that only affects the bowel. And even in the cases of ulcerative colitis, where yes, typically the gut inflammation is seen starting from the rectum and making its way higher up into your intestines, you can still have manifestations of your IBD, your ulcerative colitis, that go beyond just the gut. Famously, people can have joint inflammation. They can have inflammation in their skin, like psoriasis. They can have inflammation in the eye, et cetera, et cetera. And so there are quite a number of manifestations that can occur in ulcerative colitis that go beyond just the gut. So
Yeah. So you're saying AI is wrong?
I'm
AI is
saying that,
very wrong?
yeah, we're better than AI.
Thank goodness we still have a role here. Yeah, I agree with you 100%. We talk about ulcerative colitis being a disease of the body, right? A systemic illness. And that just means that it can affect anywhere from head to toe. Like Dr. Ugo said, it can affect different organs, unfortunately, outside of the intestines. And that's why, even if people do get their colon removed, because there is a percentage of folks with ulcerative colitis that unfortunately have to have surgery and have their colon removed for various reasons, they still can get all of these manifestations that Dr. Ugo was talking about. So it's important to understand that the disease really does affect the entire body.
All right, so score 1 for humans.
Yeah. That's right.
If I have Crohn's disease, what are the odds that my future children will have it?
Children of parents with Crohn's have a higher risk, but most will not develop the disease.
I'm going to say that's correct. Ultimately, again, this is one of the questions that a lot of our patients with IBD have. What's the risk that they can pass it on to their children? And yes, it's true that a parent with IBD is one of the major risk factors for the child having Crohn's ulcerative colitis. But at the end of the day, the numbers are actually in favor of the child not having it. And so if you have one parent with IBD, the odds that the child would have IBD is about 7 to 8 times the general population. But that ends up being just about 10%. So 1 in 10 chance of the baby having IBD over the course of a baby's lifetime. And if 2 parents have IBD, and then it's about around 20 times the risk of IBD in the child's life course. But still, at the end of the day, that ends up being just about 33%, so a 1/3. So still, as a whole, the odds that a child, even of 2 parents with IBD, the odds are is that they won't have IBD.
Can I still get a flu or COVID vaccine if I am on an advanced therapy for IBD?
Yes. Flu and COVID vaccines are recommended and safe for most people on advanced IBD therapies.
Okay. I like that answer. We recommend the flu vaccine very widely. I'll say not only for my patients who have inflammatory bowel disease, but even in the general population. So flu vaccine is safe and effective at preventing flu, or at least minimizing some of the symptoms that we can have from flu, because unfortunately it can be very severe for people. People do have an inflammatory state, like inflammatory bowel disease, where their immune system is not as well regulated, or if they're on therapies where their immune system is suppressed or not working as well. It's really wonderful to have the opportunity to protect people against any infection that we can protect them from, and especially the flu. So a flu shot is usually what we recommend because it is a inactive vaccine, which means it's not live, so it's safe. It's safe to get, and I certainly get it, and I recommend it to all my patients.
Yep. Some patients also have a concern that we've told them that we're putting them on a medication that makes their immune system not rev up and produce all these antibodies, and they're wondering, well, will the shot actually work? And although there might be a slight attenuation of the immune response in some treatments, it's nowhere close as significant enough to warrant not giving the vaccination. And so by far, the benefit of getting the vaccine far outweighs any risk of a reduced response that's relatively important.
Okay, so we concur.
Can taking prednisone for as little as 2 weeks be considered as suppressing the immune system?
Yes. Even a short course of prednisone can temporarily suppress the immune system.
So I have to say I agree with A on that one. Prednisone can be quite the frenemy. It's been, an ally in times of need over the decades in patients who've had flares of inflammatory bowel disease, especially when we didn't have our advanced therapies. But unfortunately, yes, it's true that a relatively small amount of prednisone, so up to 20 milligrams or more, taken for a relatively short period of time, up to 14 days or more, does count as immune suppression. And so even with that short period of time, we consider that as being a suppressed immune system.
Yeah, I would definitely agree with that. Prednisone being a frenemy. We say that because it is great to put out a fire, right? Meaning like get the inflammation at bay, get people feeling better quickly, get their inflammatory markers down that are in their blood or ones that are reflective of inflammation that we get by collecting their stool. But it is absolutely not a long-term medication. It is found that it is not safe long-term. It's wrought with side effects, unfortunately. And for a lot of those reasons, including that added immunosuppression when people are already on medications that suppress their immune system that we use long-term, we definitely see this as a short-term medication where there's definitely an exit strategy and a safer, more effective medication for the long haul.
Yeah. So ultimately, prednisone beyond 14 days, we do it when we need to, but with a close eye towards getting you on an effective advanced therapy.
Do all IBD patients have access to the same IBD care?
No. Access to quality IBD care varies widely depending on location, insurance, and resources.
Okay. Well, this is definitely an important question to ask, especially for Crohn's and Colitis Awareness Week as it relates to what we do in ABGH. So I would definitely agree 100%, 1000%. The answer is no. Unfortunately, quality care in inflammatory bowel disease is not shared amongst everyone. So AI had mentioned insurance, housing, potentially location, other resources, other things like racism, unfortunately, and discrimination and unfair, access to healthcare are definitely big things that we see. So, unfortunately, in our historically disadvantaged populations, so we're talking about Black and African Americans, Native Americans, Pacific Islanders, Hispanic ethnicity, and even some Asian communities face worse outcomes with inflammatory bowel disease. We're talking about more ER visits than their white counterparts. We're talking about less access to inflammatory bowel disease specialists like ourselves, and even increased deaths, unfortunately. So we are here to hopefully change that in a lot of different ways. And part of that is education that we're doing today. But unfortunately, things aren't equal across the board. But there are a lot of resources for us to get the information that we need, to get the education we need, and to empower ourselves to, make the world better for folks who suffer from inflammatory bowel disease.
Yeah, very well said. I think that, we've talked about prednisone, and we find that a lot of studies show that some African American communities and other minority communities are more likely to be left on prednisones and have medical therapies that are not the advanced medical therapies that are necessary to get their disease under control. And so it's items like this that lead overall to worse health outcomes. And that's what we're here to fight.
Absolutely.
All right, so we're all done. How do you guys think AI did?
I think I'm surprised. I think over time, AI has improved in terms of some accuracy, but it is interesting that it never really gives a complete picture.
Yeah. I mean, it plays it safe, as it should.
That's right.
But I think, thankfully, that's where we come in. So I think the expertise, right, the years of practice, the context, right, of seeing patients with inflammatory bowel disease and their different journeys is a really important, critical additive. But I got to say, I was pleasantly surprised by what AI gave us.
Yeah.
So
I think ultimately AI is great for home research, doing your work to make sure you're aware of what terms mean or what things might come up with your discussion with your doctor, but ultimately not enough to cut out the doctor conversation just yet.
absolutely. Nothing replaces the conversation you have during your clinic visits and that support that you need and the trust that you have with somebody who's caring for your inflammatory bowel disease and you as a whole. So come see us.
And so we'd like to welcome you into our world. blackandgastro.org is the website. ABGH is the organization. We've created a doctor discussion guide for moments just like this. You might be home wondering what your symptoms mean, wondering how you can interact with your doctor. And we've created a guide to help you think through some of your symptoms and some of the questions you might have for your doctor to make sure that your next visit is the visit you need it to be.
Absolutely. So, we're here to empower and we're here to educate, and the Doctor Discussion Guide does just that. So please visit us at www.blackandgastro.org. Everybody always makes fun of me when I say www. Either way, find us there, and you'll get the information to help you have the most valuable visit you can. So good luck to you.
Yay, human.